Hey everybody, Dr. Scott Keller. Today we're going to continue with some foot and ankle mobility and stability work. Alright, as we all know, very important to have proper ankle dorsiflexion through the joint here to get into a good position in most of our lifts, on the rower, when you run, all sorts of things. Always important. Okay, so we're going to do what's called a banded ankle dorsiflexion mobilization with a posterior bias. Last week we had that band wrapped around the front. That's an anterior bias, really working on that joint. Today we're going to have the band wrapped around the posterior side, back in the Achilles area, to kind of help loosen up some of those tissues on the backside, the Achilles tendon, the overlying fascia of that area. If those areas can get stuck together, they can really create problems as far as limiting dorsiflexion. We're going to pair that with another tripod of the foot exercise today, which is once again really important to get the base, and we drive up with most of our power comes through the middle of the foot. So as we've said before, the tripod is the heel, base of the little toe, base of the big toe, and we really want to drive up, you know, anytime we're doing cleans, snatches, squats, deadlifts, all through the middle of the foot. Okay, so the first one here, you're going to take your band and wrap it right around the backside in that Achilles tendon area, okay? Tie it around something really stable, such as the support posts of the rack. Really get a lot of tension on that band, so step back quite a ways, and then all you're going to do is work that knee straight forward over the toes, okay? I like to do it like this. Some people prefer to have this leg out in front. However you're comfortable is fine, okay? Just like last week, we're going to do 10 reps going forward. Okay, and then we're going to angle our knee out over more of a 10-15 degree over our little toe and do the same thing, 10 reps on that side. Okay, switch and repeat on the other side. What I also recommend, I mentioned this last week, is putting a weight. I don't have a weight here, but I'll use a book here right underneath the ball of my foot to kind of give me a little lift, and I'm going to get even more dorsiflexion. If you're able to do that, please do that as well. Okay? So that's the mobility for the day. The stability exercise, the tripod of the foot with hip flexion and external rotation. We kind of did this a few months back, but we have a little twist on it today. It's going to make it a little bit more challenging. Last time, basically, I had you concentrate on grabbing the floor with the arch of that foot and then stabilizing on one leg, flexing your hip, externally rotating, always concentrating on the 3 points, the tripod of the foot. Today, the only difference here is I'm going to have you balance on that foot and lift all of the toes off of the floor, okay? It really accentuates getting that arch, grabbing or kind of getting on the floor, creating that stability in the middle of the foot, and then you can't grip the ground with your toes. So a lot of people, when I say grab or torque, they'll really grab their toes in, and we don't necessarily want to do that, okay? So I'm going to have you start on both feet. You're going to lift your toes, shift to one side so you're balanced, keep your toes lifted, flex the hip, and then externally rotate, okay? And as you can see, I'm really having to kind of fight, getting my toes want to go down and help support myself, so I really have to stabilize with the ball of my foot and then the heel, okay? I don't want to go up on my toes, I don't want to rock back on my heels. So again, we're going to lift our toes, I'm going to keep them lifted, go up, and then out. Really trying to balance, come back slow, and down. Keep those toes lifted, externally rotate, back, and down. Okay? I want you to try to do 10 repetitions per side, guys. All right, that's it for today. Good luck.